Welcome everybody to our live Dr. Phan here, Dr. Nguyen Phan out in Texas. Muneeza,
Howdy.
howdy. It's a Texas greeting, right?
Yes.
Um, to welcome to our it's sort of like a podcast, kind of.
Sure.
Sure,
Yeah, whatever.
whatever we should call it that. We asked you guys last time if you wanted us to create a podcast, and you guys were like so excited about that. So guess what? We're working on it. So yeah, we're very excited. I'm just going to post a little quick thing to Instagram, let people know that we're here. And we got some amazing questions in the chat, in the story that we posted. And I'm going to start with some of those questions and wait for people to show up live and continue the Q&A with that. So as always, welcome Dr. Phan to the show, and to welcome everybody who's in the audience, sitting and listening and watching and, asking your questions, which is why we do this, because I think that a lot of people, while they have some answers to their questions or have some answers about how to heal, while they're healing, tend to have a lot more questions, and lots of stuff comes up for them around that. So let's get started. So we have Deborah Lynn Land. Hey, Deborah, nice to see you here. Jen from Florida, welcome. Seraphim Orama, love to be here. Hey, Muneeza. Hey, Seraphim. So come on and ask your questions. And I'm just posting this up. All right. So once it posts, I've got questions in the chat box. All right. So our first question is a really good one. Tanusha Glusha asks, let me pull it up. She goes, I am entering menopause, and what should I do?
Okay. What about menopause do you want to talk about? Because there are people who are menopause, like they just easy peasy, smooth sailing. This is the greatest time. I don't have a cycle anymore. I can be with my husband and not worry about getting pregnant. So we have to assume something. There's some kind of problem with menopause, right? Whether that's hot flashes, or you're worried about the supposed decline that people tell you that's going to happen, like you lose muscle, or you're going to gain weight, or whatever it is. It all comes down, if you read medical media information, right, to the adrenals and liver, if you're talking about weight and such. So support the adrenals, bring on some supplements. There's a whole Cleanse the Heal protocol in there. Muneeza has much more experience as far as advising women on that. And if it's hot flashes, there's so many things: Vitex berry, Shashandra berry, cleanse the liver, do some advanced 369s or 369s, any one you can get to, and support the adrenals by eating regularly and keeping things, kosher there.
Well, I mean, let's talk about something interesting, right? You and I had a chat the other day, and I asked you a question. I'm like, Dr. Phan, what is a true thyroid symptom? And according to Medical Medium, I always said, from the time that the Thyroid Healing book came out, I said, this book is more about what's not a thyroid symptom versus what is a thyroid symptom.
Yeah.
And you said a true thyroid symptom is
a little bit of fatigue, a little bit of feeling cold, maybe a little weight gain, but not always.
Because but most people said an enlarged thyroid.
Well, yeah, because the thyroid is enlarged, it's pushing down on you, and right. So that's a true thyroid symptom.
It's a true thyroid symptom. So let's talk about menopause in the same way, right? What is a true menopause symptom?
So a true menopause symptom would be an adrenal symptom. It's mostly probably.
Well, yeah, I think when hormones change, when we go through puberty on the first end of it, and on the other end of it, we go through menopause. So we start the fertility process and we end the fertility process, right? I think true menopause symptoms, you see a little fatigue, but what about adrenals being weak at that time? Hot flashes, Anthony says, are a liver issue. So, there's that. Often we have an activated Epstein-Barr that can activate at the time that we go into the loss of the reproductive cycle for women. And so if if a virus becomes activated at that time, it coincides with with that change, and we think it's a change, but it's not the change. So in terms of a true menopausal symptom, one is the loss of the cycle. That's a true menopause symptom. The loss of ovulation is a true menopause symptom. The loss of your fertile mucus, that's a true menopause symptom. Um, and all the others, like vaginal dryness, loss of libido, hair loss, weight gain. By the way, you guys, listen up. Do these sound like thyroid symptoms? Do they sound like commonly accepted thyroid symptoms? Because I think, right? Isn't there an overlap between when women say I'm going into menopause, so I have hair loss, weight gain? Right. There's an overlap that we believe at the right age it's a menopause symptom, but at the wrong age or the other ages it's a thyroid symptom.
Well, there are many doctors who have told patients, like, 32 or 21 patient, it's hormones. It's like, well, you're still having hormonal cycles. You're still having your cycle.
Right.
Yeah, it is hormones, but it's the adrenal hormones that are like adrenaline and cortisol. That's the issue, not necessarily because a lot of women come to me. I think I have hormone imbalance. I'm like, okay, yeah, not necessarily the sex hormones per se, more so of the adrenal cortisol. That's the problem. And my years of doing thyroid disease, because I used to be like the Oprah Winfrey of thyroid hormone and bioidentical hormone replacement. The things that Anthony said in his books, like, oh my gosh, I learned that the hard way. I mean, nobody pointed that out until I had to learn, like, actually giving patients medications and stuff, saying these symptoms are not getting better, despite me getting the thyroid better with supplementation, whatever it is, hormone supplementation. The symptoms don't go away, whether it's weight or whatever it is. And then you have to ask yourself, what is the difference between a hypothyroid symptom versus an adrenal fatigue symptom? Many of them overlap.
Yeah.
That you're taught by the popular alternative medicine crowd.
Yeah, exactly. Many of them overlap. And so what is the true reason? I think people then do blood work. If they see the thyroid off, then they'll say it's thyroid. But when you lose the cycle, they'll say, oh, it's menopause. And it's sort of like just like a kind of knee-jerk reaction, which is like, oh, if I see this, then it's this, and I'm not going to look any deeper. But also, even when women have menopause and you have a loss of estrogen, so actually that's a menopause symptom, the loss of estrogen, right? Because you're not reproductive anymore. And so you see a drop in estrogen. And what are a lot of the therapies for menopause are the hormone replacement therapies, right? So people believe that's a menopause symptom, that you need to replace the hormones. You need to take either, estrogen tablets or hormones, or you need to do bioidentical, but it's the hormones that they add in. But also, Anthony says, right? So when we're struggling with our reproductive hormones, it's also, the root is what you just said, adrenals. Right. So if your progesterone is off, your estrogen is off, your luteal hormone is off, your follicle stimulating hormone is off, like all of those hormones, if they're off and they're not tracking within range, the root cause is adrenals. The chat box is blowing up. Lots of people resonating with this, Dr. Phan.
Yeah. I mean, I used to say, and again, I don't know Anthony's specifics of this, but I used to say, like, if your body has to think about, like, okay, so I have to invest my energies in reproductive and sex capabilities versus survival, which one is more important, right? Your body would typically choose survival rather than reproduction and sex. So your adrenal, like your adrenals will go stressed out, and your libido will go. Your drive for reproduction will go.
Yeah.
Right. So you have to decide whether I'm going to divert my energies this way or that way. I tell you what, you're in a caveman. You're a caveman, and you get pregnant. You're a cavewoman. You get pregnant. You import, and there's a saber-tooth tiger everywhere. You really are not going to think about like having a baby, because it's harder to get away from a predator with a baby sloshing in your belly, and you got to forage for more food to look for energy sources to sustain that baby, and that puts you at risk. So when your body's under stress, it's not looking to have to reproduce all the time.
Right. So Leslie Schmidt saying, I didn't get these symptoms that we're talking about, menopause symptoms, till 3 to 5 years ago. And I think, Leslie, what she means is that she went through menopause way before those symptoms showed up. Leslie, am I right? I think that's what you're meaning. Kathy Loso is asking, how long does menopause last, Dr. Phan, typically?
Well, menopause, from the conventional sense, is the loss of the menstrual cycle, basically, right? And usually, I mean, from then on, I mean, if you get your adrenals right, those symptoms go away. But they can last for a long time. I have 70-year-olds who think that they get hot flashes again, and the original loss of menstruation was in their 50s. Like, I have a re-menopause. I'm like, no, it's not. It's not re-menopause. It's your adrenals are going off.
And the liver, because the hot flashes come from an overburdened, struggling liver, which is what's really at the root of that symptom. So, Kathy, if you're finding that such symptoms are lasting a long time, or vaginal dryness is lasting a long time, that has to do with viral loads, overburdened, sluggish liver, weakened adrenals, all coming together. I mean, Anthony has mentioned that vaginal dryness is an adrenal symptom, right? It's not a hormonal symptom.
Yeah.
And it is hormone in a way, because adrenaline are hormones, but it's not reproductive hormones that are the problem. So how does it, I mean, do we know, Dr. Phan, how long a healthy menopause period is supposed to last? Because, I mean, women go into perimenopause, right? So I think anywhere between when you start to become menopausal, maybe a total of, say, 6 months to 18 months to 2 years. Like, that's the range during which time you lose your cycle slowly, because I do know women who their cycles start to get further and further apart, and slowly, it just goes away.
It's different each person. They can have that. It's just different for each person. I have women 2 to 3 years still having these issues.
Really?
So I can't tell you that I have a specific time frame that these symptoms will go away and stuff like this.
Well, I mean, I'm not talking about necessarily symptoms that coincide with menopause and are really something else. I guess I'm meaning to say, if in a healthy woman with no viral symptoms, no overburdened liver, gosh, I would love to find her. What really is the time frame for a healthy menopause? But I think what you're describing is like the cycle. Another symptom that is a viral symptom, right, can be that the cycle becomes irregular.
Yeah. Can you hang on real quick? I need to step away real quick.
Sure, no problem. I'll keep going. So the cycle can become irregular, and an irregular cycle means that often women think, oh, it's viral, and then it goes on, like Dr. Phan was saying, for some women, it's going on for a long time. So it's going on for a long time, and what that means is that actually that's not menopause. That is a EBV in the reproductive system that is causing an irregular cycle. So Noelle says, is this live about a specific subject? We are taking questions. Often we end up with the thyroid, adrenal, women's health, hormones type questions because it's a very popular topic. But no, it's open for any and all questions. So our next question that was posted, Dr. Phan, let's change gears a little bit.
Mm-hmm.
How do I heal Hashimoto's?
You knock down Epstein-Barr virus, basically. The root cause of Hashimoto's is not autoimmune. It's your body's response to this invader called Epstein-Barr virus, or other viruses, but typically it's Epstein-Barr virus. So here's a quick thing that I say. You don't feed the virus. You take away the troublemaker foods. You support your adrenals so that as you kill the virus and starve the virus, you can deal with taking toxins out and the ups and downs of it. And then you work on killing the virus with the supplements and the herbs and stuff, basically support your body. So starve it, kill it, to support the adrenals is the main things. But you got to read the kind of the nuances and work on it. Everybody's a little different. Some people can handle more or less, and you have to sometimes work with a practitioner if you have to.
Yeah, it's you got to kill off the Epstein-Barr virus. That's 100% the right track. So when you get thyroid symptoms, you should also know, as per what Medical Medium has written about in his books, that thyroid symptoms are stage 3 Epstein-Barr. It's at stage 3 before it becomes stage 4 and it goes into the central nervous system. Although, Dr. Van, haven't you seen women with neuro symptoms and thyroid symptoms? So it's sort of already happened.
Yeah.
Can be both, right? But if you're not yet neurological, that's a great sign. So don't feel discouraged that you have thyroid symptoms. Know that you're not at the main level of like last level of Epstein-Barr attacking the central nervous system. You can actually do pretty well pushing it back at that point and never experience neurological symptoms.
You can be there for years, actually.
Right.
Now you won't necessarily kill all Epstein-Barr. You can't ever kill it because it's a herpetic virus, and herpetic virus like herpes 1 or 2 always stay in the system. But your job is to keep it at bay and weaken. In fact, it's nice because that will be a placeholder, so new Epstein-Barr variants and mutations can't come in and establish king of the hill.
Right. Exactly. So, question related in the chat box about what we were discussing before, but also so many questions about hormones. Stephanie is asking, what is the optimal range of thyroid hormones or TSH?
Okay, depends who you ask, right? If you're looking at the reference range on the lab test, it says anywhere from 0.45 to 4.5, whatever the units are. I say without medication, optimal is less than 2. That's my experience. But again, Anthony has not said that. Even if you're at a 5 or a 4 and you're feeling good, you don't need medicine, right? I don't think you need to. But when you get to the other symptoms of heart failure and swelling, things like this, you might want to support yourself. If you're definitely like you're on medicine, right, and your TSH is like 2 or 1, and you're like, oh, I can get off medicine. It doesn't work that way, because what happens is without the medicine, your TSH will go up higher. So you have to kind of slowly get off it, especially if you've been on it for a long time. So it's dependent on your case.
Yeah, so I agree, because I've seen many people with different ranges, and that's just the range. There's one woman I know who had pretty low TSH. Dr. Fang, she used to test every 6 months, and it was trending downward and it was low. And she was on this protocol for healing thyroid. And she goes, should I stop it? Because I feel like I'm like headed in the wrong direction. But she's like, I've always been low, below range, almost below range. I've always been this way, and I'm trending even more. So what you're saying kind of makes sense, right? Everyone can have a little bit of their own range, and it's not just by what is on a lab test.
Listen to your symptoms a lot.
That's the key. Listen to your symptoms. Okay, so another question related to hormones is, how do I support myself while taking bioidentical progesterone? I just started 2 weeks ago.
So bioidentical progesterone is not bad, as problematic as estrogen or testosterone, like this. If it's wild yam derived, great. But it depends. Is it a pill? Is it a cream? The pill has to go through your stomach and then processed by the liver. So there's more. If that pill also has like peanut oil, and other fillers and binders, and you do the best to clean your liver out. So basically, doing the protocols, doing celery juice, all these different things, right, and getting your adrenals better. So maybe you don't need to rely on it as much, right? But bioidentical hormone progesterone does tend to help women become more relaxed and sleep better, and it kind of takes the edge off some of these things. So
yeah, it helps you feel a little better, but it's not going to get to the root of the issue. So another related question is, if I have high estrogen, what do I do for that?
So you have to ask the question: why is the body putting out high estrogen? If you're not on anything that's adding to that, then there's something your body is doing to kind of convert there. And so again, you go back to the liver, you go back to the adrenals. Why is the body sensing that you need to put out more estrogen? Or are you getting kind of a xenoestrogen, like a foreign estrogen somewhere. I don't know the case, so it's hard to do. But again, going back to the basics, cleansing your liver, helping the adrenals out,
Yeah, I
and
mean,
working on pathogens.
sources of natural estrogen can be from plastics, exposures to plastics, and exposures to phthalates and VOCs and all of these types of things. You know what? Look up the term hormone disruptors. Um, Often, if you have high estrogen, you want to be asking like where you might be getting toxic estrogen in your system. There's a difference between good estrogen and toxic estrogen. So you don't want to always just assume that the estrogen that you have in your body that's high is your own natural estrogen. It could be toxic estrogen. So you really want to like work with that, because there's foods like Dong Quai is a herb, and Vitex berry, and some of these herbs can help to steady some of those hormones. But also, you cannot do any hormone work without working on the adrenals first. The adrenals are the key. They're the master glands. You must always, always, always focus on the adrenals. All right. So next question is, I have a 4-year-old daughter, always has enlarged tonsils. She's off all the no foods. Why do you think that is? What could be going on?
So is it posted there? So
No, it's not here. It's from the chat. It's from the Instagram stories.
okay, can you read that again for me again? What's your question again?
I have
I'm
a
reading the
4-year-old daughter.
Uh-huh.
I have a 4-year-old daughter. She always has enlarged tonsils, and she's off of all the no foods. I'm wondering why.
Yeah, so there's typically a viral issue going on still, right? She's off the no foods, but are we all doing something to actually fight it down? Is anything else feeding that viral issue? Because her immune system at 4 years might not be very strong to knock down the virus. So are you giving her the zinc? Are you giving things to support the adrenal? I'm sorry, the immune system to fight things off a little bit.
Yeah.
That's one thing. But again, children, get these infections all the time.
Yeah. And you want to push back. I think if they're enlarged, that means that there's inflammation there. And that means that a bug is probably on them. It may not be an active strep. It could even be an Epstein-Barr, because Epstein-Barr, one of the symptoms of mononucleosis can be enlarged tonsils. And that doesn't mean that there's just strep. It could be both. Maybe your kids already had strep and it cleared and the symptoms cleared, but they're still enlarged. That could be a chronic issue, and that chronic issue could be Epstein-Barr. So, keep working on the tools. The person who wrote that is very familiar with the tools, knows what to do. So shock therapies and dealing with the underlying virus, I think, would be the most important thing. So another question, this one's about a heart attack. My husband just had a heart attack. STEMI, STEMI. I'm sure you know what that means. What supplements can I help him have for his recovery?
Yes, so here's the thing. Is he willing to go more plant-based to kick up the fats, the oils, right? Because your blood is going to be thick. If you've had a, ST elevation MI, that means there's a blockage somewhere and enough oxygen getting to the level. You got to thin that blood out. And the best way to do that is to remove the fats and unfortunately, a lot of the animal protein has a lot of fat in it. So you can remove the fats. Supplements wise, I think there's a whole protocol on heart issues in the Cleanse Heal books, but get them on the celery juice, get them on even the antivirals, because pathogens can also gunk the blood up too. And you want to cleanse his body as much as you can. But those are the simple things to do.
Yeah, those are good places to get started. I think that with heart issues, 100%, you've got to deal with the food and the diet, getting those fats down. I also think you want to get hydration up, get glucose in, get more mineral salts into the system. And also, because a heart attack happens when there's an electrical problem in the heart. Correct me if I'm wrong, Dr. Phan. When there's...
I would say there's a blockage. There's a heart attack is when there is a loss of oxygen or perfusion to a certain area tissue in the heart, right? So usually there's a loss of blood flow to that area because something is closing it off, whether it's a spasm or a true blockage of the lumen of the inside of the artery that's like a plaque,
Yeah.
right? The viruses also can cause plaques. Accumulation.
Epstein-Barr can cause plaque.
Inflammation. Pathogens can do that, right? They can cause inflammation and cause a blockage of the artery, even temporarily, and then there's not enough blood flow to that area. And so, of course, physical damage can do that too. But when we're looking at these things, it's typically a long-standing plaque that has ruptured or gotten kind of stable after being built up for years.
Right. And so removing that is very important. But also to keep a healthy heart, do you advise keeping a good electrolyte balance in the blood?
Absolutely, yeah, definitely.
Yeah.
Absolutely.
So having like lots of trace mineral salts, glucose, which provide that good electrical balance, is important to maintain an easier time for the heart. Because if the heart gets strained, like say for example, you have a buildup of plaque and oxygen's having a hard time getting through, and then the heart gets strained for whatever reason. Say your husband's been drinking coffee, that can make it worse. It can increase the chances of the heart attack, because coffee, even with somebody who doesn't have a blockage, can cause a heart attack, right? So coffee, because it produces so much adrenaline, puts strain on the heart and causes an issue. And it's the reverse polarity, right? Doesn't Anthony say it's a reversing of the polarity, which is what coffee does? It reverses the electrical signals, and that can just cause your heart to go. So often we see these issues all combined. You have the blockage, the lack of oxygen. You have the electrical signals not getting to the heart in the right way, in the right amount, in the right times that the heart needs it, and the heart becomes strained. And when it does, it's easier. So what you want to do is remove all the strain and burden off the heart. So, it's a similar thing to the liver, right? When the liver gets strained, you got to take the burden off the liver so it can heal. And it's the same for the heart. So supplements, what would you say is the top supplements for the heart?
CoQ10.
Yeah.
Right. Any antioxidants you can bring in for sure, right? Yeah. Magnesium is very important.
Yeah.
Of course, the antivirals, the B12 is also very important for the nerves to give you the right signaling. We were talking about cat's claw and lysine and zinc and those ones. Also, Oregon grapefruit is important. For the heart, very important, because some viruses can definitely, HSV6 can affect the heart. We see 20-year-olds having atrial fibrillation, irregular heartbeats from these increased load of caffeine. There's so much caffeine. That's why you have these like fit 30, 40-year-olds who are doing these things and have this heart attack all of a sudden. Reverse polarity. But the conventional world doesn't talk about that very much. So.
Right. So I would say hawthorn berry is very important for the heart. I would say that Oregon grapefruit, very important for the heart, to protect the heart. So hawthorn berry, Oregon grapefruit, CoQ10, like Dr. Phan said, lots and lots of antioxidants. So I would bring in MSM, ALA, NAC. NAC I think is very important as well. I would bring in curcumin, critical, would also dissolve the buildup of plaque in there. So these supplements are supporting the heart, but then you also have to address the liver, because many heart problems actually are connected to the liver. So if you're not addressing the liver, then you're remiss. Like, you really want to do that. And then lowering animal protein, animal fats, even plant fats, keeping a very, very low fat diet supports both the liver and the heart. So that's a critical move. And then doing 369 cleanses, that's really helpful. Or even doing the 28-day cleanse or the heavy metal cleanse, like lowering the fat through a cleanse, one of the medical medium cleanses, which is written the right way, balanced for the body to do. Those are very good steps to take. Reishi, really helpful for the heart too. And I would say olive leaf. Olive leaf helps to maintain circulation, blood pressure is really helpful for those things. So it lowers blood pressure. And I'm imagining that if your husband has thick blood, he may have some strain on the heart because of the thick blood. like Dr. Phan said, fat thickens the blood, which is another source of the buildup of the plaque. So olive leaf can be very helpful. Pomegranate juice, very helpful. It tries to clear up the blood, clear up the arteries. I think that's super helpful. So you got a lot of tools here. I hope your husband can use them and feel better soon. All right, so let's jump to a question in the chat box here in the live. Seraphim Orama says, my question is related to adenomyosis and endometriosis with a lot of symptoms and pain during the whole cycle. What can be the cause and what would be the best way to start healing? Can I have kids?
Yes. Again, it takes a lot of work. The root of the issue is the virus that causes adenomyosis and endometriosis. It can also be strep related, depending on the what they find in there. But basically, you want to work on the pathogens and you want to cleanse the body. Viral toxins that are causing the issues as well as the viruses themselves. So all the things we talk about as far as getting off of doing the antiviral protocols, right? Then of course you want to bring in other things from hormonal support. I think in the Cleanse and Heal there's actually a protocol for endometriosis, so you can follow those. If you're not already doing medical medium celery juice and morning cleanse and heavy metal detox and stuff, but definitely bring in the protocol supplementations and stuff like this. But yes, you can have children. The people I had one lady. I want to say she was 48 or 50 at the time, and she went to OB-GYN doctor, really good patient of mine. They ultrasounded her, the pelvic ultrasound, and they said, well, yeah, we need to cut this out. Everything is just horrible. It's going to, you need to come out. And she's like, no, I'm not going to do that. I'm not going to do all these things. She did the medical protocols. She came back, I think, a year later. I'm not exactly sure timing-wise. And he's like, well, the OB-GYN doctor's like, well, when did you have your surgery? And she's like, I didn't have any surgery. So how could that be? Because the changes in your pelvis are totally different. You must have had some type of surgical intervention. She's like, no, I didn't. I did these protocols. That was nice. That's it. See you, bye. So it can be reversed. It takes a lot of effort.
Yeah, I mean, there's many people in the medical medium community who've healed endometriosis. And I do the Blossom program. Actually, we did the last call of our Blossom program today, which is all about pregnancy, fertility, issues with fertility, things that get in the way, birth, postpartum, nursing, all of it, like all the women's stuff. And Dr. Phan, really cool thing. 3 women at the end of our program today announced that they're newly pregnant because of the tools that they got in the program. Cool. Awesome.
So you trade your adenomyosis for a sexually transmitted dependent.
Yes, exactly. I don't know if you heard what he said, but he said adenomyosis can be helpful for a sexually transmitted dependent. So anyway, so you can heal, do the protocols, bring in the tools. The core 7 I talk about a lot. So B12, zinc, micro, sea lysine, cat's claw, lemon balm, licorice root, baseline supplements, add in, nettle leaf, red raspberry leaf, vitex berry, schizandra berry. All of these can be super helpful tonics for the reproductive system. And you want to cleanse, because when there's a buildup of tissues in the wrong places of the body that can be so painful, you can help reverse all that. You can, as you heal, those tissues stop being swollen, they stop being inflamed, the viral loads go down, and your pain levels eventually come down too. Now, there's some cases where it's too much pain, women can't cope, so they go get the surgery done, which is fine if you make that choice. But you really then have to work harder to make sure that you recover from the surgery and then make sure that it doesn't happen again, because the root cause wasn't eliminated, right? So you still have to do the work to eliminate the root cause so you don't end up in surgery again.
Marilee and Orla, these are supplements you just named out. Those are answers to your questions, basically. On Facebook, I think you guys are on. You guys' question.
So Orla's question is, how can you share how to best manage estrogen suppressant medication? Should I take it? I had breast cancer surgery, no cancer now, and it wasn't in my nodes. So
that's something you really need to talk to your doctor about, your team about, because we're going to give information and it will probably clash. Obviously, somebody's told you need to be on this medication. The doctors want you to be on it. So, but remember that the estrogen supplement suppressant is not taking care of the root issue. The root issue is not estrogen hormone in excess. It's the virus is taking that hormone or whatever stress hormone adrenaline cortisol and using it for its own means so it can create more breast cancer or whatever it is. Okay, so you really got to get to the root of the issue. Whether you decide to be on this suppressant, it's up to you. There are side effects, obviously, with other these things because it's going to put you into a kind of a menopause state, basically.
Mhm.
And you have to try to reverse. I don't know how old you are, your medical issues, but work on the virus, basically.
Right. That's the key. That's really the key. Um, okay. Our next question is from our Instagram chat, and it says hypoglycemic and seizures after a stroke. Been on MM and low fats for 3+ years. What are the best healing foods? So she's saying that she became hypoglycemic and had seizures after a stroke. So that's an interesting one. I have questions for her. What's
Yeah,
your have at
there's
this?
a lot of stuff to kind of tease out there, but the kind of a generalized thing is why are we having hypoglycemia, right?
Yeah,
Because if you're eating medical medium way, you should be getting enough glucose in your system. So if that's not happening because you're not eating regularly enough, or it's hard because you had a stroke and you can't swallow, I don't know how severe the stroke is, but are you getting the glucose in your system on a regular 90-minute, 120-minute interval, or even more frequent than that? Some people have to do that. Because if that's the case, if you are doing it on a regular frequent interval, then you may be having issue with adrenaline cortisol too, which is basically creating a franken insulin. It's kind of adhering to that insulin and not allowing the insulin to work well to uptake that glucose into your system. So it's hard to know exactly what's the case. But if you're in pain or you're stressed out because oh my god, I had a stroke, or the doctors are pressuring me to do this, and you're putting on adrenaline, it can affect the ability to uptake glucose because that adrenaline cortisol is now adhering to the insulin and now allowing insulin to get into the receptor and bring that glucose from the blood into the cell. But again, it's hard to really kind of speculate.
yeah. Um, it is hard to speculate. I think so. If they've, let's just back up a little bit. We can reverse into it. So had a stroke, right? Which means what? Thick blood clot, right? Medical Medium writes about this in the Brain Book, that the root causes of strokes are clots that get created in the blood because of too much thick blood. And, we have certain treatments out there that have been making this problem a little bit worse. He also talks about clots form why to grab and like take away a foreign particle that the body perceives as a foreign particle. So if you happen to have certain things that were injected for any reason, they could be
Maybe a while ago, it may not be right 2 weeks ago, maybe a while ago, it could be that long.
exactly, it could be a while ago, and it builds in the system over time, and then you end up having stroke because you're trying to if you've been on low fats and healing foods for a while, this could be one explanation. I don't know. I'm guessing. Maybe it's not for you. If it's not for you, then you want to think about, well, how many years have you eaten a high fat diet, or was it from the time you were little and for decades? And think of the amount of time that it would take, even if you've been fat free for 3 years. Maybe there's still stuff in the liver that needs to be cleared up, and the liver is not quite where it should be at this point in time. And remember also, right, Dr. Phan, clots don't form overnight. They can take years to form. So if a clot was already forming before you started the protocols, and the protocols didn't work quickly enough to take it away or make it go away, that's probably why you're dealing with it. Does that make sense, Dr. Phan? What do you think?
Yeah, the trajectory, as you call it, a trajectory is there, and you haven't diverted it enough to kind of get there. Like I started medical medium and I'm doing celery juice, and all of a sudden I get this kidney stone or whatever it is. Yeah, it's going to happen. And
Yeah.
hopefully we kind of reduce the severity of it, but it's hard. It's hard to know. Like how do you predict that? But again, we don't know what kind of treatments you've had. We don't know what kind of stressors you're going under, which could even cause a vasospasm, a temporary spasm of the artery where you don't get enough blood flow and it causes a stroke. Because if you just close it off like this, well, what causes a spasm? Well, the nerves close that artery off because of adrenaline cortisol feeding a viral issue. Hard to say.
Right. Right. So, so I would say, if you're hypoglycemic, clearly there's a blood sugar problem going on that needs to be addressed. Could be related to the liver, same as the reason for the stroke or what have you. Now, you said seizures after a stroke. Dr. Phan, what would trigger that? Is that a common thing?
Yeah, you could have one. Again, anoxic brain injury, meaning no oxygen to the brain, and now your brain is just kind of like almost frazzled, fried, and it's easy to have the metals that are already there to kind of like short circuit, basically a short circuit, and then you have a seizure. So yeah, that's a possibility, and now you got to heal yourself as best as you can, pull the metals out and thinning the blood as much as you can in a natural way.
Right.
Even viruses can cause strokes too. If you've got a certain type of virus, it can cause
Yeah,
problems.
100%. It can contribute to the whole problem. So we have another question here from our chat here. I'm going to pull it up on the screen. My mom took a medical treatment and she has atrial fibrillation, and the hospital has put her on blood thinners. How can she reverse this condition?
I mean, full on the medical medium, if she'll do it. The challenge is, again, even in my own practice, is people doing full medical medium stuff, because they're the minority of patients who are dedicated, who maybe even they know that conventional treatment doesn't do anything, but that means same almost thing where you have a heart attack, you get off the high fat, high protein diets, you make the blood thin, you bring the antioxidants, you bring in the pharmaceutical exposure shot, on a regular basis, and you work at it basically.
Yeah, and actually, Nikki, if you don't know, in the Brain Saver books, Anthony has a whole protocol for atrial fibrillation, and he says that I think it's part of the cranial nerve inflammation protocol. I think he says to refer to that. So basically, he says atrial fibrillation. Dr. Van, could you explain why atrial fibrillation is a cranial nerve issue? I mean, it's happening in the.
Well, so yeah, so people think it's just the heart, right? From the conventional standpoint, atrial fibrillation is what? So you'll know the atria are the chamber parts of the chamber of the heart, and they pump in a certain way because the heart has its own electrical kind of system to
Yeah.
help pump it, right? So the atria, collect the blood, and so fibrillation is when it's not. Atrial fibrillation is when it's not pumping in a regular fashion. It's an irregular heart rhythm, basically. So it won't pump in the same way, and it's easy to form clots when you stop pumping uniformly. So, but what is messing up the electrical signal? That's what you have to think about. Well, the heart itself, if it's been damaged from heart attacks or viral inflammation or something like this, but also there's one component that Anthony talks about is where the nerve blocks of the brain is helping regulate the beating of the atria. So again, this is why neurological is an issue. Then there's the whole liver component where there is these basically sludge from the viruses that is getting into the valves and affecting the ability of the valves to shut, to open and close, and cause irregular rhythms as well. So it's not just the heart; it's other portions of it. Did I explain that right?
Yeah, no, I think that helps a lot, and I hope people can see why it's a cranial nerve issue, because the vagus nerve goes through the chest cavity and has an impact on the heart. And so if it's inflamed, it can have an impact on the heart, and it's one of the main nerves that's a cranial nerve that actually goes all the way down to the center of your gut. So even if you have a gut problem because of an inflamed vagus nerve, while it's appearing in the gut, it can also be related to a cranial nerve inflammation problem. After all, it is a cranial nerve, right? Even though it goes so far out of the cranium.
Yeah.
So I hope that makes sense to you,
What
Nikki.
happens in the vagus doesn't stay in the vagus. We talked about that, right? The
True.
vagus nerve controls the autonomic or the automatic nervous system, and those functions include digestion. You can't control digestion consciously, at least. Breathing, heart rate, even it goes up into the brain, into the ringing in the ears and taste. This is why people who have long C, they have loss of taste, because this portion of the vagus nerve that goes in the facial nerve innervates that taste portion of it.
Yeah. Yeah. Thank you. Nikki saying thank you for that. All right. So our next question is from our Instagram. And someone is asking, how do I move healing with stubborn COPD, coughing, thick, yellow, sticky mucus, and wheezing? So let's first explain, Dr. Phan, what is COPD and why is it different than just a cough, cold, flu, or say asthma? What's specific about COPD?
Well, COPD stands for chronic obstructive pulmonary disease, right? And
Right.
typically, you think about those people. You think about smokers. There's emphysema and there's chronic bronchitis. But at the end of the day, the tissues in the lungs are getting damaged and hurt, and the ability for you to oxygenate and exchange, oxygen and get to your body is compromised. So chronic bronchitis, typically you have a lot more like they say like I don't know 3 months out of the year, when you have this like thick mucus that comes up and it impedes the ability for air exchange and stuff like this. So people with emphysema, like they tend to get really skinny because they just can't. I guess they can't get enough mass in their body. Where COPD or the chronic bronchitis get kind of big, but there are pathogens involved, but there's also toxins involved that have damaged the tissue itself. So if you can exchange oxygen where there's a lot of thick mucus, you have to understand there's probably a little bit of these pathogens that are going on as far as strep and whatnot that are interfering, creating mucus and things like this. And if you're eating the standard American diet because you think it's healthy, then it's
Yeah.
making that worse.
100%. Really great explanation. So, COPD, if you're producing that thick mucus, what's at the root of that mucus, right? It's pathogenic, and you've got to eliminate the underlying viruses that are rooted causing COPD. And then also, I think diet plays a big role. I had a couple of clients with COPD, and they were eating fats and nuts and seeds and meat, and we had to cut some of that stuff out because when we did, the mucus eased up. Because again, I think it has to do with the more thick your blood is, the thicker your fluids are, and the thicker the fluid in the lymphatic system is. And mucus really comes, I think it travels through the lymphatic system, because you can have mucus in your lymphatic system, right?
Yeah. So the thing is, I had a patient. You probably heard this. I'm sure I might have said this before.
Yeah.
He went to his lung doctor. He's got really bad sleep apnea and blood mucus, can't breathe through his nose. It's the worst case of sleep apnea that this lung doctor has seen in 20, 30 years, basically. And when he started getting off eggs and dairy and the troublemaker foods, he could actually breathe through his nose. He was like, he'd come in and just snorting. He's like, oh man, I can breathe again. Da, da, da. And and he had to be using what they call BiPAP, which is more intense than a CPAP, continuous pressure airway, positive airway pressure to push air in his body so he can breathe at night. So he got off that because it didn't serve him well, and he could breathe better. And it was astounding him. Like he would go and sometimes eat barbecue, and things just got worse. Everything. So he knew that he couldn't get certain foods in his body, and so it was very dramatic for him to change his diet.
Medical Medium used to have a radio show about COPD. I don't know if that's still available on Apple Podcasts, because some of those old radio shows were actually, I think, deleted and they're no longer available. Dr. Phan, do you know if it's still available?
You might want to try SoundCloud because
Found it,
sometimes,
actually. I just found it. So I'll put the link in.
yeah,
Awesome. I just found it. It is available. So
yeah.
I'm going to take this link and put it into the chat box here. So it's a link to the COPD Medical Medium radio show, which he talks about a lot, about what's really going on with the root causes. So there's viral issues, there's strep usually involved. So you have a bacterial issue on top of that, which can impact things. So I just posted that link there for those, for those who are interested in that. So, all right. So lots of questions, Dr. Phan, lots of questions today. Guess what, Dr. Phan? I didn't tell you this yet. I'm in my office after first time since November.
Yes. Finally back.
Finally back. Yes, indeed. Okay, so let's go to our chat here, live chat. So we're getting a lot of questions about what are the best supplements for the adrenals?
Yes, the best supplement for adrenals is adrenal snacking. Foods, actually, eating, keeping your blood sugar stabilized. And of course, there's ashwagandha, there's nettle, there's lemon balm if it helps calm you down. There's so many of these things. I mean, B12 is good too. What else?
Yeah, so licorice, ashwagandha, Dr.
Yeah.
Um, Adrenal Health Formula by Gaia Herbs can be helpful. The daytime maintenance and the nighttime restore. There's two different formulas, but rhodiola is really helpful. Ginseng is really helpful. Vitamin C, really helpful for the adrenals. You know, parsley, Anthony has said, is really helpful for the adrenals. The adrenal fight or flight stabilizer shot is very stabilizing and supportive of the adrenals. So I treat brain shots, they're food, but they're kind of like a supplement in a way as well that they can help support. So yeah, for those of you, there's like 3 people asking about best supplements for adrenals. So I hope that answers your question. So our next question is, what are the best supplements for period cramps or premenstrual cramps? My daughter gets nausea with her period.
Red raspberry leaf tea, 3 bags. You can get traditional medicinals a lot of places. 3 bags a day for at least 6 weeks to see the difference, right?
Yeah.
Start there. Put it in a jar overnight. In the morning, you'll have the tea ready. Put some lemon and honey. Then you have a lemon, honey, raspberry tea that your daughter might like.
Yeah. That's a good place to start. Also, if you need to act more quickly with a cycle and it's happening now and it's cute and the red raspberry leaf hasn't worked as of yet, you need some time for that. Some magnesium glycinate can be soothing. Lemon balm can be soothing. Curcumin and California poppy, very soothing for that condition. All right.
Heating pad is quick too.
Yeah, exactly. All right. So our next question is from, it's an interesting one that was asked earlier on to Heal From Within says, what can you do to heal Phelan-McDermid syndrome?
So that's considered a genetic thing, right? And so when we talk about genetics, I mean, Anthony has said genetics doesn't cause all the diseases. It can give you certain aspects of your bodily growth or development, but when there is a genetic issue, you always think about, in my mind, heavy metals and even viral toxins.
Right.
Can you reverse it totally? I mean, no. I mean, probably it's kind of like, can you reverse a broken arm? And it's not like you can reverse a broken arm. You can help it. You can help it heal and whatever it is, but you would do all the protocols to pull the metals out and viral loads basically. But that's whatever symptomology that comes from their type of their manifestation of this syndrome, then you would use those protocols on top of that.
Yeah, and I would say all genetic disorders have a big element of toxic heavy metals in them. So definitely bring in all the cleansing for that, like advanced heavy metal detox smoothie. You want to bring in even the extractor smoothie. Dr. Ryan, do you know the symptoms of this condition?
I think you can have more like ASD or autism spectrum like symptoms, basically.
Okay. Then toxic heavy metals is right on the money.
Yeah. So those are some of the major ones. Everybody has their own things as far as developmental.
Right. Okay, so our next question is from Dursa. She says, my HDL is 53, LDL is 230, triglycerides 233, and my lipoprotein is greater than 600. So my doctor ordered Lipitor. How bad is that number, and what should I do? Is Lipitor a statin?
It is a statin drug.
Yeah, okay.
And anything is like Lipitor, Crestor, any of these ors, these are statin drugs, and what they do, what Anthony has said, is that they kind of push the cholesterol back into the liver, back into the vessels, and so you get a good number in the blood.
Right.
Does everybody with a high LDL, do they all have heart disease? No. In fact, he would rather the cholesterol be floating around rather than coagulate and compress into one area. So this goes against conventional medicine. So you have to decide what you feel comfortable. Because your doctor says, "Why did you take this when you had a heart attack, you had a stroke?" And you're like, "Well, because this doctor on YouTube said so." And I'm like, it doesn't hold up very well. So when you make a decision about being on those meds, you definitely need to decide why you're doing it and make a free will choice. You got to bring in CoQ10 because the Lipitor, the statin drugs, they deplete the CoQ10. This is more a sign that your liver is backed up and it can't process that cholesterol. So you decide whether you want to be on that. I mean, they say there's like a 1% increased risk of diabetes and stuff. I think it's higher than that, but the literature says 1% increased risk. You have to decide whether you feel good about that or not. You're scared and you're still eating tacos that are fatty. Okay, get on the statin drug then. Go ahead and do that, right?
Right.
You have family members who are not going to follow medical medium, then you may want to do that because if something happens and they're like, see, he should have been on a statin drug and he wouldn't have had a stroke. But again, you decide where it's at. Sometimes your body's pushing out stuff. If you've been on a statin and you got off a statin, that cholesterol goes sky high and it'll scare the crap out of you. So in what context is this, cholesterol level? Because I imagine it's been there for a while.
Yeah, I mean, it doesn't get like that overnight, right? So yeah, I think that it's been going on for a while. And then how bad is the number really? Is the number bad? What you're looking at, Dr.
I
Phan?
mean, yeah, and it just says your liver has been probably high protein, high fat for a while, and it's inundated with stuff. And not just 4 years; it's probably longer than that.
Yeah.
Yeah.
Yeah. So I think the diet is the number one thing to address this issue. I don't even think that many supplements could help. Some of them could, but really this is about diet and cleaning up and lowering fat. So I hope you're able to do that, Dursus, and good luck with cleaning it all up. So we have a question about postpartum emotions, especially tearful at small things, 9 months postpartum, and it doesn't feel right. So Anthony talks about how when you become like today in the membership community, we were doing, we have the light club. We call it the 144 light club. So we talk about the things that bring light. And today we were talking about foods that bring light. And one of the things that we were reading from and pulling from was Life-Changing Foods, where he talks about how people can become chronically emotional. And he says that it's a disconnect between like the gut and the heart and the head, and it's a metaphysical disconnect, and that these foods can kind of bring you back. So I would say, Melanie, really you want to work with bringing in like the brain shop therapies here. They can really help. So if you have like teariness and emotions at small things, you can bring in the obsessive thoughts shifter shot. You can bring in the mood shifter shot. You can bring in the energy shifter shot, the adrenal fight or flight shifter shot, stabilizer shot. I would start to focus on those. They will really move the needle for you. And then maybe there's some guilt and shame. You might want to do the guilt and shame shot. Maybe there's, you need an ego shifter shot. It's very specific purposes that ego shifter shot works with, and not just one having a big ego. There's other purposes in there too that can help to reconnect the brain to the heart, to the gut, and reconnect you both on a physical level and a metaphysical level. So I would say work with that. Liquid sunshine, orange juice, really helpful for those difficult, depressive type of emotions. 5-HTP, GABA, melatonin can also be helpful. I mean, are you sleeping enough? You're a new baby, you can get so out of whack with the routine, and if you don't have support. So I hope, Melanie, that this is helpful to you and that you can find some relief using some of these tools. Dr. Phan, any words for Melanie?
Yeah, guided meditations. If you can do some of those, that'd be helpful. The other thing is that sometimes viruses can kind of rev up, cause postpartum anxiety, and things like this. So Epstein-Barr sometimes does that, depending on how stressed your immune system is. So
Right.
if you want to do some antiviral protocols, that might be helpful to B12. Definitely, you can do a shock therapy of either lemon balm or B12, and if you see how that kind of shifts things, if anything.
Right. So our next question here is following up from Tori, who said earlier that she started bioidentical progesterone. And she said she's taking the progesterone because she's been bleeding for 15 months straight and now is severely anemic and has hypoxia. And I need to stop the bleeding ASAP. The wild yam cream stopped working after a month. Is there anything else that we could recommend to her to do for this?
Well, again, if you want to talk to they have some band-aid approaches to stop it immediately. But again, if the root cause of it is this viral thing going on that's causing uh, dysfunctional uterine bleeding or fibroids or whatever it is, because you're just losing a lot of blood from that. And you can take iron all you want, but it's not getting to the root of the issue until you do that. But again, if your OB/GYN doctor has something to stop it right away, do that so that you can get some temporary relief until you can work on the protocols to get to the root of it.
But also viral component here, meaning it's viral in nature, Tori. So I know you know the tools, I know you know the protocols, and I totally get that you need to stop the bleeding. So you can't take vitamin C or curcumin too much in this case because you're bleeding this much. It would actually be counterproductive to include those. So, but you can do other things. So I hope that I'm praying for you. I've actually been thinking about you quite a lot and praying that you can turn this around. All right, next question is from Lisa. She says, my toddler has a heart murmur. What could be the cause? Does she really need an ultrasound?
Well, I would consult with your pediatrician or your pediatric cardiologist as far as it goes. Sometimes heart murmurs can go away, and so the only way to assess from the conventional doctor's mind is to look at an echocardiogram, which is basically an ultrasound that they put on the chest, and that's not going to be as invasive or problematic because it doesn't have a lot of radiation. But they want to look at the structures. Is there something that you were congenitally born with a valve that needs to be fixed? Because as we get older, the valve may be compromised and they may have to replace it if it's already damaged. So that's the reason to go do the ultrasound. The cause could be viral, heavy metals. It could be, again, temporary infection that will still grow out of. I don't know how symptomatic your toddler is, but it would depend on how far you want to go and how comfortable you feel. If the doctor's like, oh, I'm comfortable watching it, then okay, great. Meanwhile, you work on protocols. But if it's like, oh, I'm getting blue in the face or blue lips and you might want to go a little more aggressive about that.
Right. Yeah, talking with a heart murmur. I think if my kid had a heart murmur, I would be taking them to get an ultrasound. Right? It's not something you want to mess with. You don't want to take chances. You don't know what it could develop into. So you want to keep an eye on it. And an ultrasound is one of the safer, diagnostics that you could use. It's non-invasive. It's low radiation, very low radiation, and I would encourage you to go do it. Yeah, because at least you can stay on top of it and know exactly what's going on. Which, as a mom, I know that my adrenals and my worry would need to know exactly what I'm dealing with so that I can calm myself down. Otherwise, I'd be worried all the time and thinking, what could it be? What could it be? What could be? And I think that in this particular case, given it's your kid's heart, you don't want to mess with that. You would go, you should go get that checked out. Interesting comment here, Dr. Phan, from Jay Markwell. He says, I'm in the 9/11 community as a responder, and we have a lot of COPD.
Yeah, definitely. With the heat going on, with other upper respiratory infections, viral stuff going on. I mean, I'm seeing a lot of recurrence of the C, even though it's kind of low level. It can exacerbate the things that normal people can deal with respiratory-wise. People with COPD are that much more weak, or asthma even. So they're much more susceptible to pathogens and even the heat.
Yeah. I think COPD, you can use a lot of the tools that he has for bronchitis, because they thin the mucus. I think that's a really key element to managing the disease is to thin the mucus. So lowering the fat, adding in bronchial wellness syrup, adding in the bronchitis broth, which is made of equal parts celery, radish, and onions, doing the steam water with onions in it regularly just to thin out the mucus. It's a decongestant. It will pull out the mucus more easily. Doing those tools. NAC is a really great tool for opening up the lungs and allowing breathing to be easier, but also things like the turmeric garlic shots and the pathogen exposure shots and the mold exposure shots are so helpful to pull out mucus and really just keep pulling it out. And while these foods and tools are antiviral as well, so they will address some of the root issue, but you would need a more full-on supplement protocol too. But I hope
NAC and glutathione. I mean, this is from Muneeza, who's had asthma for many, many years, and so she goes through the whole breathing issue a lot.
Yeah, I've dealt with asthma a lot, so I know what it feels like when mucus gets stuck and fluid gets stuck in the lungs and you can't breathe and you can't lie down. And you can't sleep, right? So I
Did
totally
you say 150 antibiotics, 150 prescriptions?
147 courses of antibiotics in my life.
So you're still in your liver. We're still cleaning it out.
It's still in my freaking liver. I am still cleaning
Yeah.
that crap out. And not only that, but over 20 courses of prednisone.
Yeah.
Steroids. Yeah, it's a lot. And all when I was a kid, right? So
Yeah.
like birth to like early 20s. So yeah, totally. Really, really, really tough. All right, let's go to another question. This is about the sea bug. She says, after the sea bug, I became allergic to sulfurs. So sulfur, like ALA supplements, is very beneficial to me, and I can't take it anymore. So why is that?
Yeah, it just comes down to what the body has changed since having that. I mean, you can't. I mean, you may be killing things off with the sulfa stuff, and your body just can't handle that. It's too fast. It's a healing reaction that you guys just can't handle. But yeah, I mean, there's a lot of things your body changes as you get hit by something.
Yeah, I think that the body changes. I think that, it could have. Remember that getting the sea bug strains the body in a way that the flu doesn't, right? I mean, would you say that that's true? Because the flu can strain the body, but we see very different. We see, very different patterns with the sea bug.
Yeah, definitely.
What are some of the patterns that you've noticed that we could help educate people on here?
I mean, you get the lung syndrome, the lung syndrome, basically, and it affects the vagus nerve. Basically, it comes in, it knocks your immune system down, it goes away, but other bugs that are there, Epstein-Barr, shingles, whatever, will wake up. So some people get Bell's palsy afterwards, or they get the vagus nerve, they get dysautonomia, right? It means that you're like POTS type stuff, where your body can't control your system anymore. And so you have all the symptoms that you read them, you're like, this sounds like chronic fatigue, it sounds like hypothyroidism, adrenal.
Yeah.
Shortness of breath, loss of taste, menstrual cycle changes, body aches, you name it. A lot of these things, because those viruses that cause all those things wake up, because it's like your immune system is a jail warden, and it got exhausted by dealing with COVID. And so your jail warden can't keep the other prisoners at bay, and they come out of their cells and wreak havoc. And this has been corroborated by, Yale or conventional medical sources, where they're saying a reactivation of particularly Epstein-Barr causes these symptoms that could mimic your multiple sclerosis. There's weird symptoms.
We see very weird symptoms. I would say the same thing. Like, it's not just as loss of taste and smell, which has been weird from the beginning with this thing, but we see so many symptoms of viral, it really impacts the adrenals somehow more than any other thing I've seen. It just hits the adrenals super hard. And that's number one. Number two, it will drive up viral loads like really quickly, because the body's been under so much stress during the time it's trying to fight for its life. And I think within that realm of those two things, we see a range of things that can happen. So it's weird. We're all still learning. Every time we get a client, we're like, oh, I didn't expect this. It's new, but it happened to them after they got the sea bug. So yeah. So Elena says, I developed GBS symptoms after getting the sea bug. So basically she's saying like Guillain-Barré, that's a viral thing. That's really intense and really tough thing to deal with. So I apologize for you. I'm so sorry that you're dealing with that. That is rough. That is really rough. All right. So let's wrap up to doing our last couple of questions. A couple of good ones for you, Dr. Phan. So one, Anela asks, is cat's claw or lysine safe for children, and in what quantities?
Yeah, you can, but you have to consult with a practitioner who work on that, because I think, I'm not sure if in the Cleanse Heal or the latest Brain Saver, he gave doses for that. I think he gave
Brain Saver. No, lysine is not, there's no children's dose for lysine, but I think what you can do is, even cat's claw, I don't think there's a children's dose, but I think what you can do is estimate using a child's dose for, say, lemon balm, using lemon balm shock therapy, or a child's dose for golden seal using golden seal shock therapy, and estimate using that what a good child's dose would be for cat's claw, right? Remember that what golden seal, The adult dosage is the highest of all the shock therapies. It's 6 droppers every 4 hours. And the others are like 3 droppers every 4 hours, or 4 droppers every 3 hours. There's different ones. Cat's claw, I wouldn't err on the side of as high as golden seal. I would probably go towards like a B12, which is 2 droppers every 3 hours, or a lemon balm, which is like a 4 droppers every 3 hours, something in that range.
Cat's claw is more aggressive than lemon balm.
Yes.
So they're both antivirals, but lemon balm is more gentle. So you can use like the transitive property of, math to kind of figure out like there's a dose in there, and of course you watch your child, right? Depending how big your child, how old the age is. There's no correct. I mean, if you work with a practitioner, Muneeza can give you pointers, but it's hard to really say this is a throw out to everybody because they may be really sensitive and they may have like feel bad, and you don't know until if the child can articulate that or not.
Yeah, exactly. That's a rough one because of that. So our last question for today is really, can we heal while undergoing stress?
Yes. People do it all the time. But some people, the problem is, what is your perception of stress, right? So some people can handle 5 things at once. Some people, one thing at once is too much for them. So they're used to handling 5 things at once, so they don't feel like they're stressed, but they are.
Yeah.
So really, it's a perception game, like pain, right? I have women who can have childbirth, no epidural, and one woman who cannot handle it, they have to have everything. So it's their perception of stress and your perception of what is really adrenally stressful to you. Your body will react to it regardless. But you don't know. You can't. It's just like a monitor. You can just like pull up a little device on your head. Oh, I'm at stress level 3 now, and there's no thing to do that. So really, you can heal. People have done it.
Oh my gosh, yes. I mean, I think that the human body has far more capability for healing than I think we are led to believe. I think that people heal under all circumstances. People heal while going through a divorce. They heal while, dealing with a car accident, losing their homes, fires in California. I mean, you name it, pandemic, right? What haven't we been through? We've been through all of it. All of it's stressful. Losing your job, losing your savings, becoming financially, bankrupt. I can't lose loved ones. I mean, losing pets. People do all of that and they still heal. So I hope you'll take heart and know that if you have stress, there are things you can take to counteract stress. So if you're stressed with your adrenals, adrenal fight or flight stabilizer shot is super helpful. If you're stressed with your adrenals, taking the adrenal supplements we talked about earlier on the call, it'll help you a lot. And also supplements to calm down the nervous system, like lemon balm and magnesium and GABA and melatonin and 5-HTP and California poppy. I mean, if you took all of them, you would literally be super zen. I took them while I was displaced from my house. I would feel so stressed, and then I would take a bunch of these. I do magnesium glycinate, I do some lemon balm. Sometimes I could only get 2 of them. Those are my main 2 that I would do. Oh, it would go from feeling like I was like 1,000 out of 10 being stressed out to feeling like I'm okay. Okay, I'm like 9, 8 out of 10. I'm feeling so much calmer and better. So use the tools. They can help you even while you're healing. Any final words before we wrap up today, Dr. Phan?
Well, like, Rob Schneider's character in The Waterboy, right? You can do it.
Yes, you can do it. We're here to help you. This is why we come on and talk about these topics with you, so that those of you who struggle with resources, money, time, energy, you can gain something from these lives, and we want to answer your questions. And so I'm going to post a little question on Instagram. Go and tell me, do you want us to start a podcast? Tell me. If the response is big enough, we might think about it. All right, Dr. Phan, we've done over an hour today. Thank you so much for your time. So grateful to you.
And
thank you for your wisdom, for your knowledge, for your heart, for your humor, your compassion. It's amazing to have you in the community. And I look forward to doing this again next month.
Spiritual high five.
Spiritual high five.